Hi everybody, we're live again. We decided that since I had a very short thing by myself, which was, I thought it was pretty good. I ended it with showing our really cute foster Winifred. But it was reasons you should take your cat to the vet. And now Ellen, our head technician, I'm Dr. Erica Barron. We're here at Nova Cat Clinic in Arlington, Virginia. We're going to talk to you about the gift that keeps on giving, unfortunately, which are fleas. And they're gross and terrible, and we hate them.
And we're still seeing them in the month of December.
Well, that's because the ground never freezes here completely, so those jerks don't die.
No, and unfortunately today we actually had a surgery that we were working on, and I went to take the kitty cat's temperature, and a little tapeworm friend came out of his butt.
And just to remind you, you get a tapeworm by eating a flea, and it didn't have to be like within the last week. It could have been a couple of months ago. But that's gross. I remember when Cleo was little, she had tapeworms, and it freaked Matt out, and it was really, really funny because she was so little because she has a defect, and she has pectus excavatum, so her dent grew in instead of out. And this little tapeworm, he was in bed with her, and this little itty bitty kitten, she might have been like 2 pounds. This little itty bitty kitten had a tapeworm walk out, and he was like, and he freaked out. But he couldn't throw her because he wasn't gonna throw this little kitten. And he put her down, and, whipped all of the blankets and everything off. It started spraying Lysol everywhere, and I was just standing there it's not gonna help. Sorry.
I was telling Dr. Heath when
it was
I worked
so funny.
at an animal shelter. I was doing husbandry for the day, and apparently one of the doctors the day before went around and dewormed all the cats, and I'm feeding everybody, and one of our cats starts heaving, doing the
poor
finally
cat.
He throws up, and he throws up a tapeworm.
Yuck.
And it was just kept coming out, and it was disgusting. And it's writhing on the floor, and this is
we're probably not getting a lot of views because we're talking about really gross
15
things.
Plus years ago
really
now,
gross.
and I remember being horrified seeing.
I've seen real at the clinic I used to work at. I saw it was gross.
We saved it though in a formalin jar because it was worthy
gross.
of saving.
It was really gross. So anyway, let's talk about things we can do to prevent them. And the other thing we should remember, because I feel like we see this all the time based on where we live. So if you live in a metropolitan area, or if you live in an apartment building, even if your cats never go outside, they can get fleas from your neighbors.
Yep.
It's awful.
Yeah.
Last year, we had someone on the 23rd floor of a building, and their cat was infested with fleas, and their cat only ever comes here once a year, and it was infested. And they were they didn't even, to us it was a clear infestation, but they didn't really notice. It just looked like some black dirt, some chin acne, when they get chin acne and it looks like just some black dirt.
You got neighbors that take their dogs outside. They're going to bring them into the apartment, and then the fleas just keep finding buddies as they go on down the hallway. So it is very possible for apartment pets to get fleas, and unfortunately it can be a big problem because most of those apartment complexes are carpeted.
Yeah, it's yucky. Yeah. It's really, really yucky.
Have you ever seen a diagram of the life cycle of the flea, and they always have that cutaway of the carpet, and they show you all the eggs and the little pupa and the little dead bodies and stuff inside of it. It is disgusting. You will never want to lay on your floor ever again.
Yes, so that's why there's a couple things that have come out. There's that one new product. Have you used Brevecto at all?
No.
Okay, I like Brevecto. It's a new product, and it's one application every 3 months. So from a practitioner's point of view, even though it is a topical, and some cats have a hard time with topicals, I'd rather do topicals if I can, because I cannot for the life of me pill most cats. I know I'm a cat vet, and I just can't do it, and I admit it, and it's okay. There's a group for us. But oh look, your mom's here.
Oh, my mom's here again. Hi, Mom.
Hi, Ellen's mom. So one of the things I really like is a normal flea infestation. To really kill everything that's present, it takes 3 months to stop the life cycle. So the nice thing about Brevecto is I can put it on the animal when they're here, and then it's done. Oh, look, Marnie's here. Hi, Marnie. Please tell little Rue Russ I love her. She's in my picture on my Fitbit. Did you know that?
Little Rue Russ ask for no elbows this Christmas, and she actually grew elbows when she wasn't supposed to?
It's amazing. It happened. Who grows elbows?
It's a miracle. Christmas miracle. She has elbows now.
So if you guys don't know who little Rue Russ is, she is one of the cutest kittens ever. I guess she's almost is she an adult now technically?
Yeah,
I guess she's an adult.
She's over 6 months old now, yeah.
She's an adult. So, she's like the cutest little thing ever, and you can follow her on Instagram or probably on Facebook too.
Marty, I just had my hair in a surgical bonnet. I know it looks like a mess right now,
I think it's
but
fine.
thank you.
I think it's fine.
Big and puffy.
So anyway, in case you guys become friends with me on Fitbit, little Rue Russ is in my picture. She's in my Fitbit. She's really famous. She's like one of the most famous people I know. I'm okay with admitting it.
What do you hear about the people that are complaining about the Seresto collars, them getting the irritation?
I haven't heard too many. I've heard like a handful. I've heard a handful. What about you? Do you feel like there's a lot? Thanks for the hearts. We love it.
It's a good product in certain situations. There are cats that will have a lot of chemical sensitivity. So if you have a cat that most likely had a sensitive reaction to a topical, I see a lot of the cats with a Seresto collar sensitivity as well. And a lot of times it's usually from people not completely removing the foil piece from it, and there's these little pieces on the inside of the collar. If they press too hard on the cat's neck, and then they wind up getting sensitivity from that, and they wind up getting, this horrible ring rash. So you have to pay attention when you're using the product, because they are good products, but you have to pay attention to the directions explicitly in order to get the product to be like 100% of what they want to do. But every single product out there, if it is a topical, there is a possibility of having a skin reaction to it or skin sensitivity to it. One thing that we should let you guys know, if the product is not recommended from your veterinarian, do not use it.
No, I've seen things. I've seen really bad things. Ooh, hit the done. I've seen really bad things happen from people just buying things at the pet store, and we don't need to get into all of those bad things that can happen. But just do me a favor, get it from your vet. Like, just do that.
And if it's in the grocery store, it's a red flag. Don't
do that. We've all seen bad emergency things from that. Marty, thanks for sharing our video. We appreciate it. And then Amelia has a question. She said, did she say that she grew her elbows back? So
it's an ongoing joke.
She didn't have elbows. She was born without elbows. She was like a little Roo, like.
But she moves
like
her arms
kangaroo.
like she has elbows. So it's an
really
ongoing
cute.
joke with
It's
Roo.
like a little T-Rex.
Yeah, she's a little T-Rex.
She's
She acts like a
T-Rex.
T-Rex, man.
Nova took an x-ray a few months ago after she learned to walk, and she is missing the joints, but the bones now joint. Yeah, that's exactly right. They fuse together somehow, and she's a miracle. Let's just call it what she is. Little Roo Russ is a miracle, and she's the cutest thing.
Yep.
She's so freaking cute.
Yep.
So another thing that I really like, in a lot of the products we've mentioned, they don't do anything for heartworm disease. And I just want to remind you that heartworms, unlike other types of parasite, live in blood vessels. So if you think about a worm living in your blood vessel, that's really bad for your heart. It's like a really, really bad thing. And cats, unlike dogs, they only need like one to kill them. Dogs need like a boatload usually. Cats, it only takes one. And not all the tests work well. We can get into all the nuances. But it's not good. So I really like using Revolution on my cats because it helps prevent heartworm disease, but it also gets fleas.
And did you also know there's no current heartworm treatment for cats?
Right, which is bad. In dogs, it's the one in dogs is really, really painful, and it's also really, really expensive, and it can be super, super toxic. You also have to be really careful that when the heartworms die, they don't like lodge and like. It's this whole thing where if they die the wrong way, they can lodge places and things can get really bad for them too. So it's not good. I had this dog at a clinic I used to work at, and she was getting treated for heartworm disease, and they were really, really nice. And then the next day she ate like a handful of chocolate-covered raisins, and so we had to make her throw up. But usually when you make a dog throw up, you kind of like shake them around and like bounce them around after you give them hydrogen peroxide or whatever. And we couldn't do that because we couldn't take the chance of her like bouncing around too much to break them. So we were like super careful.
Would you just stir her?
No, we walked her like slowly, and we tried to like be excited with her like this, but like we didn't want her to run. It took a while for her to throw up, but she did, so it was okay. Good. And she lived, and she was great.
Now, Marnie, you wanted to know how often we see heartworm in cats. We don't. We have seen probably a handful here. That's because we make sure that all of our patients are on preventative, and at least once a year we would like to see everybody get tested for it, regardless if you are an indoor cat or an outdoor cat. Outdoor cats definitely should be tested once a year.
The other problem with heartworm disease, I feel like the 2 times you see it the most is
Usually when it's advanced.
well, it's usually the cat's decompensated and they're really sick, or it's on necropsy and you don't see any other signs, and then you pull the heartworm out of their heart. So it's the test isn't always right. That's why it's better just to use the prevention. But that's a great question. Thanks, Marty. It's a really frustrating disease. Actually, I was at a seminar 2 weeks ago, and they said any cat that's puking should have a heartworm test done.
That's like every single cat that walks in.
I know. Every single cat that walks, which we're not going to do, but it is something to think about. That's a great question, Marnie. She said, is this an issue with feral colonies?
It could
Probably.
be, but, you can't really test them, and a lot of people can't even medicate them or even put preventative on them. So it's one of those strikes against the feral cats of, being outside that, unfortunately, if they are heartworm positive, it is going to lower their quality of life and their lifespan itself. I mean, we just don't know unless they actually are tested and see if they actually have a, IgG, IgM. Bye. Have a good evening.
Bye. Oh, look, Penny Eastman just joined.
Hi, Penny.
Ruby. Isn't her cat Ruby?
Yes, it's Ruby. Ruby the tailless wonder.
She's so cute.
I think Ruby's a rumpy and not a stumpy Manx.
Okay. Does anybody else have any questions for us? We're nice. So the other nice thing that Revolution does is it helps prevent roundworms as well. And a lot of cats get roundworms and some other intestinal parasites it helps with. So it's kind of a nice catch-all prevention for cats. A lot of people use it a lot in Florida. The reason they use it in Florida is because the fleas are so awful. They're actually, the thing I went to with Dr. Brown, they told us that they call it Chaos 1 flea, and the worst fleas in the world supposedly live in Tampa, which I thought was really funny. A reason, one of my friends practices, in case Susan's there. Hi, Susan. She practices in Tampa, and I'm just like, haha, you have chaos fleas. I don't. Those suckers don't die. It's like that one cat that was here with the fleas that one died. Do you remember that one? And they were we had to give it two cap stars, and we were putting all this thing. We were spraying the fleas, and they wouldn't die. They were really yucky.
And he came from Florida?
No, that one was from here, but I'm assuming that maybe one of those
Chaos
fleas.
Virginia fleas?
Yes, but maybe they're stage 2 and not stage 1. I don't know the differences. I just remember, I thought it was funny they called them chaos fleas.
Right, and we all know that they are disgusting and they all need to die. And that's why we're going to put you on the correct preventative to make sure your cat does not have fleas.
You know what, though? One thing is we haven't talked about with all the flea stuff. We didn't talk about flea allergy dermatitis or flea allergies. There are some cats, they get bit by one flea and they go down this horrible, horrible allergic cascade, and it takes months to get them back to normal.
Yep, and it can be one flea and the poor cat will be covered in scabs.
Yeah.
Or bald from licking themselves because they itch so profusely. Did you know that fleas are really bad in kittens because it causes severe flea anemia?
Yes. It also, I saw an adult cat die from flea anemia.
And did you know the #1 flea bath product out there that we recommend, and it's the only product we recommend if you need to bathe your cat for fleas, is Dawn dish detergent.
Yes, it's super cheap, and it sucks because you have to wash them and then you pick them off.
Yeah.
I had to do that with my kittens. How young is the youngest kitten you use flea treatments on?
Ooh,
So supposedly Bravecto has a product that we don't have yet that is supposed to be able to be used on cats that are, or kittens that are 6 weeks, and I believe Revolution is 6 weeks. When I had kittens, Cosmo was my kitten with his sisters, I didn't do anything till 6 weeks, but that's because I didn't know that you could do other things. I just bathed them every day and picked every single flea off of them. And then by the time 6 weeks came around, I was a good cat mom in that regard, and I got all their fleas off. So that was a lot of work. I don't recommend it for anyone.
It's important to use the package insert for their recommendations. You have to remember the recommendations are there for the age simply because they did not test it on anybody younger than the age recommended. So if you use a flea product on a cat that's not labeled for their age, that's off-label use. So if you run into an issue with that drug, you're probably going to get a hand slap by the company and by your veterinarian because you potentially are using an unsafe product, even though many of the prescribed medications from your veterinarian office goes through very stringent quality control. Sometimes they'll put up to 6 or 7 times the amount that a cat truly needs to see if they have a reaction to the drug. So, those are things that we don't recommend doing unless your veterinarian is willing to work with you on that level. So the safety guidelines for their age is simply there because they didn't do any efficacy studies on anybody younger.
But I just want to remind you that many things we do in feline medicine is off-label.
Yep.
Because they don't go through all of the studies because it's expensive. And a lot of people won't use the products once they do the studies on pets. But that's why I think it's so important when we do have a great product that they did go through the studies like Revolution and Bravecto or like some of the feline-only antibiotics like Veriflox.
Yep.
I think it's really important that we use them to support that they did go through and they dotted all their I's and crossed their T's.
Same with other products like Onsior,
Mm-hmm.
So you have to make sure that you do things correctly. Anybody can use any drug, whatever they want. Sometimes you are playing with fire, so we don't recommend that.
Yes, and if sometimes we'll use like a dab of something on little itty bitty kittens because it's sort of like, and Ellen has a lot of experience with kittens, but it's sort of, do you want them to become anemic and die, or do you want them to have fleas?
Right, and then there's always a potential chance of an adverse reaction.
Right, which is why we stare at them all day. And Ellen sometimes stares at them all night too.
Yeah. I know, I keep looking up at the one that we spayed just a few moments ago.
She's napping now. If you guys watched the video I did earlier, the end of the video is her eating her snack, and she was so happy about it. Does anybody else have any questions? We don't have to just talk about icky, yucky parasites. We can talk about whatever you want as long as it's cat related, because we're at a cat hospital.
Right, I haven't touched a dog in like over 15 years. I don't think I could do dog medicine anymore.
So I don't mind doing acupuncture in dogs. I really still enjoy that, but like Western medicine, I'd rather just do cats.
Yes, Winifred got spayed today, Marnie. At 1 pound, 11 ounces.
Was Wink just?
On top of
She
that,
started winking. Did I tell you that? She goes, "Hey, I want to wink at you," and then she goes, "It's so funny."
I like it when little kids wink and stuff. I like being able to take a dog, play with it, and give it back to the person.
I just don't like my leg getting humped. I also like coming home and not smelling. Like, I can't smell. I was actually born without a sense of smell, but I like not coming home and being like all gross. Like, I would go through like 3 or 4 lab coats a day, and now I go through like 1 a week. It's pretty great. Anyway, but I mean, I do love dogs. The medicine's different. Does anybody else have any other questions about their cats or anything we can do to help you? I think it's important that if you do see any worms in the stool, that you take that sample directly to your vet, try to make it a fresh one within 24 hours, and have them run a parasite screen. I think that's important just in general, because you can't be like, oh, well, it looks like he just passed something. No, please find out what that was.
What is the biggest, most common problem you see in cats brought to the clinic? Well, Amelia, that's vomiting. Because cats like to vomit, especially today.
Today everybody wants to vomit. It's funny because I feel like every week it's different.
Sometimes we have a week of nothing but kidney cats.
Yes. So we could break that down a little bit. So I would say for geriatric cats, the most common issues are drinking a lot and urinating a lot, which often tends to be something related to the kidneys or diabetes. Except hopefully it's not geriatric if it's diabetes, because that probably means something else bad is happening. Hyperthyroidism, which means they're eating a lot but losing weight, or like climbing the walls or puking, or there's a lot of things, or cancer. I feel like middle-aged cats are usually the diabetic cats, the lymphoma cats, or inflammatory bowel disease cats, or what am I missing? I'm missing congestive heart failure cats. Am I missing anything big there?
There's also dental disease that we
Yeah,
see.
well,
in a
I
lot of
feel
the
like dental
adults.
disease is like
a broad
everywhere.
spectrum.
And then in young cats, it's like
Foreign bodies.
Foreign bodies. I did something silly.
Yeah.
Allergies. Yes, that's right. There's always allergies, especially in our part of the country. I have like the worst allergies now because I live here. There's a lot of asthmatic cats, which I always think of in traditional Chinese medicine. A lot of cats are really metally, which means they like their four walls. They like to do things the way they like to do them. They like to be fed at the same time.
Oh, so you're saying they like routine?
They like routine. Who would think? And in Chinese medicine, the metal organ is the lung, and the lung is in charge of all of the defenses inside and outside the body. Because if you think about it, that's the only part of your body that is constantly bringing stuff in and out. Like, so, I mean, if you eat something, you're bringing something in, like, from outside, but it's like you're not constantly eating, although sometimes that sounds nice, but you're not constantly eating, but you are constantly breathing. So that's why it's all of your defenses. And I think it makes sense because a lot of people who have allergies, who have asthma, also get skin dermatitis.
Do you want to tell everybody what the number one cause of asthma in cats are? Come on, you remember this.
Isn't it smoking?
It's dust mites.
Oh, you mean the allergic one?
Yeah.
Yes.
Disgusting.
Yeah.
Change your pillows.
Well,
And just clean your sheets. Everything
So,
like that.
yeah. They said that, like, if you took your pillow and after you
Used
waited
it for like
for
a
2
year,
years
yeah.
and you weighed it, it weighs like significantly more. But you know what? I love my pillow. I just changed the sheets. I have 2 pillowcases on. I have a regular
You kidding me?
pillowcase.
My pillows go in the laundry every few months.
Oh no. Well, that's because you have your own laundry, probably. I don't have my own laundry because it's on our floor. But I have like a pillowcase, and then I have my Claritin pillowcase. I love the Claritin pillowcase. Have you used that? It's so great.
What does it have, like the pill crushed all in it or something?
I don't know, probably. It's incredible. It makes it so I can breathe. It's so great. But yeah, dust mites are the most common allergen in cats, and I feel like besides for asthma, I feel like if we just reduce their load a lot of times, then they can deal with it.
Yep.
Most of them don't have to be on steroids. We can deal with it, and it's not as bad as you think it's gonna be.
No, and a lot of times, cats with asthma, they can actually be controlled with inhalants versus being put on a steroid and then running to the risk of having the diabetes caused by too much steroids in their system, etc. You want the steroid to get to the organ that needs it versus the systemic overload. So when you speak to your veterinarian, there's going to be a bunch of different choices of what can be done as far as treating your pet for asthma and or allergies, depending upon what it is.
Yeah, and the AeroCat, it looks, that's the inhaler that a lot of us use. Ellen's going to get it. It looks just like my daughter's inhaler, but the mask is bigger for her face, obviously. This is the AeroCat. Woo! So you put the little cat face in here, and you put the albuterol or the fluticasone or whatever in here. You go, and you put cat face in there. I also think that just like sticking them, my hospital cat takes albuterol for his asthma and he hates it.
A lot of cats don't like stuff on their face, and
So
unfortunately,
you just have to get them used to it.
There's not a lot around it because unfortunately there really isn't any other way to administer the drug because you want to be able to make sure that they breathe it in at least a minimum of 5 times. And that even includes if they're just breathing in very quickly, you're still getting the drug in there. But a lot of times just, holding your hand over this, pumping the drug first and then bringing it to your cat eliminates that scary noise of that hissing noise because cats don't like hissing noises, and unfortunately all those little aerosols are like pss, pss, so immediately your cat thinks that this product is hissing at it, so they don't like it. And plus, if you put something over their face, they're like, whoa, you're in my personal space. I don't like it.
Yeah.
So you have
Cats
to make
like
sure
their rules. Their
you have to
medals.
make sure that you train them first of, this is great, put it on your nose, here's a treat. This is great, put it on your nose, here's a treat. And you have to train your cats over and over again. And then start doing the drug and everything like that. So it's totally possible to get them trained for
I
it.
heard a trick this weekend when I was listening to something. One of the vets I'm friends with, he likes to use like easy cheese on everything. I just think of diarrhea, but
It looks like diarrhea.
I know. Well, I just think of it causing diarrhea, but maybe if you put like a little bit on here, they would like start licking it and be like, oh, this isn't that bad. I know for us, like the way we got my daughter to do this was as she watched a lot of TV, but cats don't really always like TV. Where's your hospital, Natasha Smith? She said her hospital cats there a lot. So the other thing to think about with this is like you don't necessarily need an Arrow cat. You could even just use like a toilet roll paper, like a roll, and put that there. And some cats do better because the mouthpiece is bigger. It sort of just depends.
Massachusetts.
Brookline. Hello.
Hello, which cat hospital?
Do you work at a cat and dog hospital or just a cat hospital?
We'll wait for her to finish typing.
Yeah, we should.
Hey, can you use acupuncture for allergies?
Yes, so there's a lot of really good points for it. I had a cat that I used to do
Metro Cat Hospital. Yay, cat hospital.
There's a lot of people who think with everything with acupuncture, there's a treatment for everything. Now, if it works, it sort of depends on the practitioner and the cat or the person or the dog or whomever you're going to use it on. There's some pets. I'm treating one cat right now for asthma, and I think that he does better when I acupuncture him. But usually what happens is I acupuncture him, and then a day or two later he has an attack, but it's always shorter in duration and not as severe. And then he's usually pretty good. I also have him on an herb, but I don't know if the herb's really helping because I really need to work on my herbal certification. I have to finish I have to ask for my extension.
You didn't study long enough, did
I
you?
haven't studied enough. I had a lot go on. It's okay. I was like, hey, do you need a doctor's note? They're like, no. I'm like, oh, wow, I'm an adult now. They don't need a doctor's note. Look at that. They trust me. But I'm getting certified through Steve Marston's course. So I'm Dr. Steve Marston. I'm really excited. But it's a lot more work than I thought it was going to be. I don't know why I didn't think it was going to be a lot of work. But
Because it's plants. There's a lot of plants out there.
yeah, there's a lot of stuff to learn. But it's good. It's good. It's a different part of my brain. It's like, don't they say like every 5 to 10 years of your life you should like learn a new skill or something so your brain like...
No, let's get a different career.
Oh.
Which that's not happening.
No. But I thought, I remember somebody saying like, oh, you have to pick up something you've never done before so part of your brain works that, you know, you're using new synapses. So I remember I
Just get a new game downloaded on your iPhone.
Okay. I heard someone say like, oh, yeah, I'm going to learn how to fly. And then after he learned how to fly, he was like, oh, yeah, now I'm running an Ironman.
No.
And I was like, oh, that sounds like that. Good for you. That's how I felt about it. Good for you. But anyway, does anybody else have any other questions or concerns?
I know, because we're getting ready to start afternoon appointments.
Yeah, I didn't have any the first hour. It was weird. It's okay. I thought I'd talk to you guys instead.
Yeah,
It was more
yeah.
fun. I mean, not saying appointments aren't fun. They're great, but this is fun too. It's different. Well, okay, Ellen, so why don't we take 2 minutes and say what our top, why don't we say what the top, if you could tell anybody anything about cats, and you had like 2 minutes and they were just getting a cat, and they had never had a cat
Oh,
before,
God.
and you only had 2 minutes, what would you say? I think this will be fun.
What would I say?
What would you say if someone came in and they just got a cat and you only had 2 minutes? Because I don't know why you only have 2 minutes, but you only have 2 minutes because I have to go to appointments soon.
Oh, no, hold up. What
Oh,
are
no,
your
this
feelings
isn't
on
good.
declawing? I have a friend that
Oh.
works as a vet tech that says declawing doesn't hurt cats.
Oh, this is not good. You should have said that on here. Oh,
That is my biggest pet peeve.
that's her biggest pet peeve.
Declawing is utterly inhumane. And for somebody that says that declawing doesn't hurt, go take a hammer and smack your fingers with it. It is unbearably painful. We have a house cat here that we are his third home due to a horrible declaw job. The cat can barely walk. He has horrible arthritis. It doesn't matter the method that the veterinarian does it as, okay? You can wind up cutting the toe pads incorrectly, etc. They can use laser. It doesn't hurt. It sure does. It's a third-degree burn on top of cutting that toe off. It is a different type of extensive pain. You have to understand pain and pain management before you can say it doesn't hurt. It hurts for a long time. Ask any amputee out there that has had a limb amputated, a finger, whatever. They will tell you they continue to have pain years down the road. Okay, same goes with the pet. Except you don't notice it in cats because they're excellent at hiding pain.
Remember, they're a species of prey and predation. They don't want anyone to ever know anything's wrong with them until they can't hide it anymore. The other thing that we don't talk about with declaws a lot, besides that it's just physically that it hurts, like you take it off, is that when a cat walks, it puts so much pressure on those front feet that
they have to learn
maybe
to re-walk.
Right, and maybe like, okay, so say I had an arm amputated. That would really be awful, but I'm not walking on it.
Yep.
Like, it's not like a constant thing. And so not only do their toes start to hurt, but orthopedically, we see changes in their spines. We see arthritis in places we probably wouldn't have. Yeah. Just because of all of this extra pressure because they physically walk on them.
And if you ever seen an x-ray of a declawed foot compared to a healthy foot, they're disgusting. It is probably the saddest thing to look at.
It's really painful.
You know?
So you heard that it's been outlawed in New Jersey, right?
I did. Congrats, New Jersey!
I thought that was really impressive.
Yay! Yankees for the win!
But anyway, yeah, we're sort of anti-declaw.
Very anti-declaw.
That's why I was like, no, you didn't just ask that. It's going to get bad. But, I mean, yeah, it's just a different way of thinking. And, you know, we're all learning things that were okay when we were young that aren't okay anymore. You know, my first cat, Moose, well, I'm sure Omar never had a dental. Moose never needed a dental. I will say, on his deathbed, his teeth look better than mine. He just had really great teeth. I get my teeth cleaned every 6 months, but Moose just had really, really great teeth. Now, he was a Meshuggah, but he was a great cat, and he had great teeth. But I remember when I started working at clinics, and I'm like, animals get dentals? What? So it's the same thing, just learning that, like, oh yeah, they have teeth, we should clean them. It's the same idea, like, cats have feet. We shouldn't cut their toes off. It's not nice.
No.
Same idea. And if you have a cat that's really persistent and scratching at things and things like that.
I like how people are more prone to, like, they want to cut their cat's toes off. But if you have a dog that rips apart the carpet or the wall or anything from separation anxiety, what do? They lock it up in a crate. They're not going to cut his toes off. So why should you do it to a cat? A cat naturally needs to use its feet. They actually have scent glands there. They're marking their area. You can be a better owner by learning how to trim their nails, taking them in weekly or even monthly to the vet office to have them done. You can use the little soft claws. They come in these fantastic colors, except you need to be smart enough to take them off once a month and change them, because we've seen cats come in with them completely
I'm not good at the
around
soft claws. I always glue my fingers together.
in the feet and stuff, but you have to not be afraid of doing practical grooming for your pet. That's the whole part of enjoying a cat. Is taking care of them, brushing them, taking care of their feet, taking care of their ears, etc. They're not just some ornament that sits around, unless it's the kind of cat that doesn't want to be touched. That's different. That's a different category. But you should be getting your cat used to, as a kitten, getting their feet touched.
You're right, Natasha.
One of my cats, you can literally run your fingers through his toes like he's having a reflexology appointment done, and he loves it. And I'm able to sit there and trim his nails without a problem, because you put effort into doing it. And believe it or not, that effort could be just you and that cat sitting on the couch in the evenings. You don't have to do a lot of we're going to work on your feet right now. We can be like, I'm subtle and I'm petting you, and ooh, look, suddenly I'm down by your feet. Take your time to do it, but you shouldn't suddenly make this horrible decision that is going to change your cat's life permanently.
You're right, Natasha. A lot of environmental changes help too. Like you need to have different types of scratching posts. Like you can't just have the tree. You have to have multiple things. I like in our little itty bitty apartment, I have a cat tree in the corner. It's a big one, and they've destroyed it. And then I have a couple of the corrugated box things.
Oh yeah, my cats love those.
But you have to get them at different levels because sometimes they want flat things, sometimes they want this way, sometimes they want something higher. And then on all of the doors we have the twine wrapped around something. And I found this old purse I have that had like straw on the outside, and I just hung it on one of the corners of my bed, and they attack that. Because I was like, I don't care about this bag. It was $10 15 years ago, 20 years ago at Old Navy, and they've just destroyed that. So I think a lot of it is if you have a cat and it's destroying your furniture,
it's probably not having enough environmental enrichment.
Yeah, and there's a lot of things you could do for that. And I think a lot of that also could go back to the no bowl. If you go down on our page, you can see some more information about the no bowl. But I think, did the research say like 70% of a cat's wake time in the wild or like feral cats is used hunting? So if you're giving them like something to occupy their day, then they're not going to destroy things. They don't have time. It's the same thing with me. Like if I get sucked into a TV show and I watch it, I'm not going to get things done that I should have because I don't have time because I was watching TV.
You don't multitask?
I do to a point, but like when I get really into a TV show, I get like in it.
Oh,
like
no,
I really like The Blacklist. That's my show right now. I really like The Blacklist, but I'm all caught up, so I'm getting a lot done in the apartment, so that's good. Like I made meatballs the other day.
Oh.
Yeah, because I wasn't watching TV.
Very cool.
Mm-hmm. Does anybody else have any other questions? Because otherwise I gotta go see appointments, and Ellen has to go home. She has to go check on Olivia.
Yeah, and try to get home on this horrible Silver Line Metro. It's the worst ever. I hate you single tracking.
Well, thanks everybody for all your comments today. We had a lot of good conversation starters, and we had, I felt like it was great. And we'll try to do this again maybe on Wednesday. I mean, if that works for everybody after we're done with procedures. Yeah? Okay. Well, if you guys have any questions, just feel free to comment below this or reach out to us here at Nova. Thanks, Natasha. I hope you have a great day, too. Thanks, Amelia. Thanks, Marnie and Ellen's mom. And I hope you all have a terrific day. And if we can ever help you, just reach out to us because that's why we're here.
Remember, be the cat advocate.
Bye.
I don't have the bottom.
Oh, it's the finish button. Sorry.